One of the most popular, the most desired, and probably the most finicky of hospitals and doctors networks in San Diego in 2025 for Medicare beneficiaries is the Scripps Hospital Network. Sure, it has world-class care. It has great doctors, but it also has a very select few ways that someone could now in 2025 actually get to see them now that they have stopped taking Medicare Advantage plans. So today, we're going to talk about 5 important things to know about being on Medicare and using the Scripps Doctors and Hospitals networks in San Diego. Hi, I'm Michael, and this is Michael's Medicare. Any of you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. So if you are somebody who lives in San Diego and has ever just a moderate exposure to healthcare, especially on the coast, you have come across a Scripps hospital, a Scripps doctor, or a Scripps specialist, or maybe even a Scripps urgent care. They are really one of the most predominant healthcare providers on the coast. But last year, or really, I guess 2023, Scripps made a big decision, mainly over the dollars and cents, and I get it. But they made a big decision to stop taking any Medicare Advantage plans. They claim it doesn't pay them enough to make financial sense for them to take it, and they claim they lost money on every interaction, pandemic, all those kinds of things, etc., etc. So that left thousands and thousands of patients who had Medicare Advantage plans through one of the many plans that Scripps previously accepted without access to those Scripps doctors. In 2024, there were some workarounds, some loopholes, some contracting quirks that allowed access to Scripps through some Medicare Advantages, but now it seems like all of those loopholes have been sealed up. So what is a Medicare beneficiary to do in 2025 if they want to utilize the Scripps Healthcare Network? Here's a couple suggestions. So first up, and the easiest option, which is very apropos since it is AEP, at least right now when I'm making this, in 2024, is somebody could drop their existing Medicare Advantage plan coverage that is no longer being accepted by Scripps, and they could go back to original Medicare. That is Medicare Part A and Part B only. Easy, done, solved, right? No. Let's face it, Medicare is a great program. It helps millions and millions of older Americans every year, including our parents and our grandparents and our loved ones who are eligible. So it is a good groundwork for health coverage, but anyone who uses it will know that original Medicare, that is Part A and Part B, doesn't cover everything. And in fact, it can leave the beneficiary with some pretty high costs if it is the only Medicare coverage that somebody has. But it is pretty much one of the only ways that a Medicare person could still get access to the Scripps network and get it covered, and not have to just pay cash. Now, if someone did decide to go back to original Medicare, that is Part A and Part B, then, there are some pretty significant gaps in the coverage, primarily because hospital coverage under Medicare Part A, there is a one-time per benefit period deductible of $1,632 in 2024, and undoubtedly it will be higher in 2025. But there are also daily rates of $408 a day, $816 a day, 100% of the cost per day, depending on how long one stays in the hospital. On the Part B side, there is a $240 deductible and on average, 20% share to the beneficiary of those costs for those services. But there's no cap on it. So, 20% of a lot, it's still going to be a lot. So that is why folks who just have original Medicare often choose to pick a Medigap plan or a Medicare supplement plan. They are the same thing, those two things, and they help to cover most, if not all, of these costs that are left unpaid by Medicare or would be paid by the beneficiary. An example of this would be a Plan G. Now, it doesn't really matter which company someone chooses as far as the plan benefits go because they don't really change. They are the same across the board. A Plan G is a Plan G is a Plan G. But if someone does get a Plan G Medicare supplement plan, it will pay for those hospital deductibles and daily costs as well as the 20% that is the beneficiary's responsibility. The most notable thing about the Plan G will be what is not covered, which is the Part B deductible. It used to be back in the day, but Congress stepped in and now the Plan Gs can't cover everything, but basically everything up to that Part B deductible. So for someone who decides to go the original Medicare route so they can stay with their Scripps doctors and hospitals, the Medicare supplement will not get in the way of that because Medicare stays the primary payer and the Medigap plan just kind of backs it up financially speaking, the costs that are not covered by Medicare. So that's another way as well. Now, when we talk about Medicare supplement, more often that is going to be Plan G because it really does cover the most amount of things that would be covered under a Medicare supplement plan. But with that type of comprehensive coverage also comes a comprehensive price. And if that price is a bit too much for somebody, because it can be pretty expensive, there are lesser Medicare supplement plans that cover less but also cost less. An example of this would be something like a Plan A. And these plans do still cover a lot of the secondary costs that come with Medicare, but it just won't be the sea of zeros like someone sees with a Plan G. For example, on a Plan A, the Part A hospital deductible would be left to be paid by the beneficiary if they had usage of any of those services. But for the later days, the daily rates like the $408 per day or the $816 per day, that would still be paid for by the Medigap or Medicare supplement plan. But for those costs from Part B, a Medicare supplement plan would still keep about the same benefits and still leave that Part B deductible to be paid by the beneficiary. So if somebody is looking to go back to original Medicare, but doesn't want all the exposure to the raw potential cost, but also doesn't feel like they need as much coverage as they get on the Plan G, and of course, still want to keep their Scripps doctors and hospital networks, a lesser Medicare supplement plan, also a pretty great option too. Another thing that would really need to be a consideration in a situation where somebody decides to drop their Medicare Advantage plan and go back to original Medicare to keep their Scripps doctors is prescription medication coverage. Because when someone has a Medicare Advantage plan, at least in San Diego, for the majority of the plans, the Part D drug coverage comes along with that Medicare Advantage plan. They are sort of just built in. But for original Medicare, it doesn't cover prescription medications. That is why it is necessary to get a Part D drug prescription coverage that would help to pay for those costs of the medications. These plans are not run by Medicare, but they are from private health insurance companies that have an additional monthly premium on top of the Medicare Part B and potentially on top of the cost of a Medicare supplement plan as well. But when someone does have the Part D coverage, it will limit their costs to lower copays, lower co-insurances, and an out-of-pocket maximum on someone's drug coverage that they can have throughout the year if they just have original Medicare. Again, instead of just paying cash. One important thing to mention here is that if somebody drops their Medicare Advantage plan with drug coverage and goes back to original Medicare but does not pick up another comprehensive prescription drug coverage, depending on the time that they go without that coverage, there is potentially a penalty for not having Part D coverage that grows depending on the time that somebody could have had it but didn't get it, or comparable coverage instead. Just something I wanted to mention. I won't get super deep into the numbers on that one in this video, but needless to say, it is important to get if you are eligible for Medicare and you need drug coverage, or even if you don't need drug coverage, it's important to get so you can avoid that penalty. So the last thing I'm going to say on this is for those folks who decide they want to go back to original Medicare so they can stay with their Scripps doctors networks, the thing is, it's not exactly that easy. This is because of the fact that Medicare supplement plans are different than Medicare Advantage plans, because they are able in some situations to do what is called underwriting. This means they could look at a person's medical records, their health history, and decline them because of pre-existing conditions, or raise their monthly rates, as they could represent a bigger risk to the insurance company. There is a guaranteed issue period right when somebody first becomes eligible for Medicare, and there may be, depending on the insurance company, a temporary guaranteed issue period that someone could be eligible for those folks who are leaving Medicare Advantage plans as well and going to Medicare supplement plans, but not all have that. And even the ones that do, that period doesn't last forever. So the best thing to do would be to find a plan that has a temporary guaranteed issued period. Or I guess if you are just now getting to Medicare, then you can jump right in and not have to worry about that. Or given that all the plans are archetypical, you can do some research and figure out which plans are going to offer those temporary guaranteed issues. Or you could talk to a professional as well if you don't want to do all the legwork. You know what? That's a pretty good idea, Michael. Thanks, Michael. No, but really, finding a professional will help, but you can do it on your own too. All right, so there you have it. For those folks who have been sort of shanghaied by the internal corporate changes in the Scripps Hospital network, that has left them scrambling to find other options to help get back to that doctor or perhaps group of doctors that could be very important to one's health or healthiness. I get it, right? Good doctors can be hard to find. And when you find one, you want to keep them. But those are a couple of the provisos, a couple of the pitfalls, and a couple of the strategies that may be helpful in achieving that goal. Because we have a lot of folks over the last year coming into our office, at least, trying to figure out what they can do in this situation. But of course, if you or somebody you know is trying to figure this out, or really any other Medicare issue, please feel free to reach out to us at the information down below, and me and my team will be happy to help to make those tough Medicare choices, either over the phone or in person at one of our many offices across Southern California. And, don't forget to like and subscribe. So that's it for today's Michael's Medicare, and I really hope that you enjoyed this video, and I hope that you enjoy all these videos. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.